Hi, I am Diana, Communications Assistant for the City of Enid, and thank you. Welcome to another COVID-19 live update. With me is the Garfield County Health Department, Maggie Johnson, Community Engagement and Planning Director, also Ray Johnson, Health Educator. Ladies, thank you for being with us.
Thank you.
Now, can you guys update us on the COVID-19 positives, negatives, deaths, and also recovering?
Ray, go for it.
Sure, I can't. Okay. We're having some technical difficulties, so I can't see anyone. So if I interrupt people, I'm sorry. For the state of Oklahoma, there have been 4,424 cases total, 266 deaths, and over 3,000 have recovered. So right now we have just over 1,000 active cases in the state of Oklahoma. Garfield County had a total of 22 cases. 20 of those were in Enid, 1 death, which was in Enid, 11 recoveries for Garfield, and 9 of those recoveries were in Enid. So we're about sitting at 11 active cases for the city of Enid.
Now, the Garfield County Health Department is still testing for COVID-19. Now, can you briefly remind us what is the criteria for testing?
Sure, go ahead.
I can. Okay. So actually right now, there aren't very many requirements to be testing. Before, you needed to be symptomatic. Now you can qualify for a test if you're over the age of 16 with a parent consent. You can be tested, but tests are still not in ample supply. The labs have become very overwhelmed, so we're not asking everyone to come jump and get a test if you would like one. We're hoping that we can do some kind of a satellite pod event in the future like we did before and get a lot of people tested. But so right now we don't have a lot of requirements, but it's still, we should save the tests, save the appointments for people that are sick and need them. Right, Maggie?
Yeah, and we're asking employers to not require a test to come back to work. That's something that our system just can't support right now. So if you're needing a test to get back to work, do your best to take the right amount of time off if you've been sick, and save the test for someone, like she said. We also can test children if they have a physician referral. So doctors
Right.
can
Thank you.
if they don't have tests.
Now, I know that the Garfield County Health Department had done extensive work testing all the long-term health care facilities in Garfield County. Now, you posted Wednesday recognizing the nurses on that team who are doing that testing, and also stating that you're almost there. Now, are you done testing all the long-term care facilities?
Sure. So first, I'm glad Ray posted that because it's Nurses Week, and any year to celebrate Nurses Week, this is the week to shower the nurses you know with gifts and love and encouragement, because all of them, no matter what facility they work at, they are in the trenches. So we're so proud of our nurses. They have gone above and beyond this week. We had originally been asked by the governor to test our long-term care facilities. In our district, we chose, we needed to do Garfield County first because we had a few positive cases come up in some of our long-term care facilities. So we prioritized those that had positive cases. We did one facility. Last week it was, how many? 250?
351.
351 tests from one facility were done last week. Not all of those tests have come back from some of the independent living residents, but from what we received back already, those results have been negative. So we're optimistic about that. The rest of the facilities in Garfield County, we were getting to use a saliva collection sample. It was a lab that was accepting sputum in a cup. And this form of testing, we wanted, the governor as well as the health department thought that this form of testing might be less invasive for our long-term care residents. And unfortunately, the lab was inundated with these samples. They got way too many. We sent in, I think from other districts as well, over 2,000 in one day. So they had asked us with very short notice to switch from collecting saliva to collecting swabs again, a nasal pharyngeal swab. And with that, we had to redirect our test kits to our long-term care facilities. So if you know someone that tried to make an appointment yesterday at the health department, we were out of supplies to test at the health department yesterday for that goal. So as of today, our long-term care facilities in Garfield County, all of the residents have been tested, and the majority of the staff, we had a few that had night shifts that have maybe not gotten a test yet, but all of the residents have. So we're so proud of our nurses for getting that done very quickly. Very long days. I know it was a partnership with our nursing homes and our health department staff, and it was a big effort. And I know the nursing homes had to be flexible with us and change plans because we received change plans very, very short notice. So we appreciate just trying to work together to make it happen and serve our long-term care residents. Hopefully that was a lot.
That is a lot of work that I can only imagine in a very short amount of time. So it's very impressive that the Garfield County Health Department was able to tackle that. So thank you very much for the nurses, because it is Nurse Week. So thank you for the nurses. Now for the—
I was going to say one more thing on that.
Sure.
Sorry, I just remembered just yesterday, they spent the day testing, and they did over 400 tests in one day. And towards the end, it was a very limited number of people. So they just deserve a lot of applause for that. It was a huge effort in one day too.
Absolutely. Wow. 400. Now, for individuals, for viewers and businesses in the Enid community that don't know what NWOK Health Business is, can you tell us a little bit more about that?
Sure. It's a Facebook group that we're working on. It's NWOK Healthy Businesses, and it's a place where a business owner, employees, just any citizen and anyone with a Facebook can join it. And it's just a place to get information, resources, posters, images for social media, anything that can help a business reopen safely. We're kind of trying to share it there. We have a ton of information in Spanish as well, all the same resources that are coming down. And just as places are starting to reopen, we want to help them do it safely. And that's kind of our flagship of getting the information out there. And any requests that we have, we're more than happy to fill and add to that page and get the information out to everybody.
Now, also on your Facebook page, you had posted a free online food prep course. Can you tell us about that?
Sure, yeah, that came from Justin Asbury, who's our food safety technician kind of for the whole district, and he has a whole team that handles all the food safety, but just the Safe Serve organization is putting out free courses for food handling. So if that's something that applies to somebody's work or their business, it's just a free resource for them to use. And that's just something I'm sharing to that group to try and just provide all these free resources to as many people as possible.
Now there is some comments on Facebook, so thanking the Garfield County Health Department and the nurses specifically for all the work that you're doing for the community. So just relaying that message. Thank you guys.
Thank you. I wanted to echo Maggie. That testing effort that, to test all those nursing homes was unreal. Our nurses were wearing their masks, from very early in the morning till late at night last night. And the staff, so they just, were working incredibly hard and without breaks, and it's grueling work. And then the staff from the nursing homes, they got the call that they had to completely change their plans, and we had to test all that painful nasal swab for all their residents and all their staff. And they were great in helping us and going with the flow and changing plans. And we're just really grateful for all the help. And I just want to say, bravo to our team, because it was a big ask, and they knocked it out of the park. We're kind of setting the example for this state, which is pretty cool. And they're they're setting the bar high. So.
Agreed. They are. Now, I don't have any online questions. So how can individuals stay updated with the Garfield County Health Department? What avenues? I know I see your Facebook. Anything else?
Yeah, right now Facebook is the best way. That's kind of where we're sharing information, and we partner with you guys every Friday to give an update. So the Garfield County Health Department Facebook page, we share information about testing and any new information that we want to get out to the public as quickly as possible. That's kind of our first place we go, and then reach out to other media outlets. But I can't think of anything else. Maggie, do you have any other ways?
Sure, we'll do our best to share with the Enid News and Eagle and keep you here. Yeah, give us a call if you need an appointment. We'll most likely, if you had to call today, we would take your contact information and try to schedule you next week.
Thank you, ladies, for joining us. Is there any final things that maybe I have missed that you guys want to jump in and share with the viewers who are watching?
Just continue to stay safe. We're asking you, just as you go out into the community, remember it's we're doing these protective measures. Sometimes it's, maybe you're not concerned as an individual, but it's for our most vulnerable people. So keep them in mind when you're going to the store, when you're going to businesses, that you're protecting those that are maybe elderly or immunocompromised. We're in it together, and we're still taking precautions. Wear a mask, wash your hands, use hand sanitizer if you can't wash your hands. All the same precautions still are so important right now.
Great. Thank you, ladies, for joining me.
All right. Thank you all so much. Have a good weekend.
Absolutely. And viewers who are watching, stay tuned for Monday, when we will come back for another COVID-19 live update with city management. So if you have any questions, make sure to message us on Facebook and we will get to all of them. Thank you.